So I've heard people like Mia Hughes and Michael Schellenberger say that the trans thing is the greatest medical scandal in human history. Should there be consequences for the people who push this?
Yeah, I think there should. I think there should, particularly because these are kids. These are kids. And we have no good... I mean, it's even weird to say there's no good evidence for it. Like, we shouldn't need papers to tell us that cutting kids' body parts off is a bad idea. I don't need a paper to tell me that. I don't care what evidence people put in front of me. I'm not okay with that. If an adult wants to do it as a cosmetic intervention, being very sober and grounded and knowing what they're getting into, that's a different thing. But to impose this on children is wrong. I do think there should be consequences. Luckily for me, I don't envy anybody who's in law or government, or I have no idea how to dole these things out, because the practice just it's almost like you're getting flooded and the water's just rising and rising, and before you know it, all your furniture is floating around your house. Like, this has happened, I don't want to say slowly, because it's not slowly, but I just think it's been in the water and it's become so normalized that I think a lot of people are just almost like in a sleepy daze doing this to kids and not really paying attention to what the hell they're doing. So I don't know how we dole out consequences for this. I mean, in the US, there are lawsuits, and I think one by one, people are going to be held accountable. And then I think eventually clinicians will be really scared. And unless they are a real gender zealot, they won't touch this with a 10-foot pole. Like, I think people used to be scared not to affirm. Like when I told you earlier about we're trained to affirm, that's fear. That is a therapist who's afraid of saying a bigoted transphobic thing. But I'm imagining maybe on the other side of this, there will be a new wave of fear of like, no, I don't want to work with these gender patients because they could detransition and sue us. So, I don't know. I don't know how to punish people who've done this to kids, but I do think there needs to be consequences.